My name is Michael Bevis, and I'm a peer specialist here at the Stout St Health Center. I work primarily with the MAT program. So what we're going to talk about today is Narcan. Normally, you're going to see it in one of these boxes. Each box holds 2 doses of Narcan. So Narcan is a 4 milligram, 1 press nasal inhaler and is the brand name of the opioid antagonist, naloxone. Narcan is not habit-forming nor harmful. The manner of ingestion of an opioid, whether injection, snorting, or smoking, does not matter as to the efficacy of Narcan. Narcan will temporarily reverse an opioid overdose, but Narcan does not clean the body of opioids. Once the Narcan wears off, the subject can relapse back into an overdose state. Examples of opioids that Narcan will counteract are heroin, fentanyl, pharmaceutical versions, pills, such, and even methadone if the person is under the treatment care of that particular MAT strategy. Alcohol and benzodiazepines, including xylazine, which we are seeing more commonly in the Denver area, are commonly ingested alongside opioids and can greatly amplify their effects. Narcan does not reverse the effects of these inebriants. So while many people are familiar with the stereotypical model of an overdose, there are symptoms that can be overlooked if they are only taken on appearances. Any of the following symptoms are reason to perform a safety check. Combinations of the following symptoms are cause for administering Narcan. Always remember, when in doubt, administer Narcan. So what you're going to look out for is abnormal or labored breathing or heavy snoring, slow to no response to external stimuli, frequent nodding or bending over unnaturally, pinned pupils, no dilation response to bright light, bluish gray lips or fingertips. So a reversal can be a frightening situation for everyone involved. Focus and crisis management can be very helpful in the administration of Narcan and the necessary aftercare provided. Some of the steps that I'm about to present can be combined if possible. So what you're going to want to do is if you find a subject that is in need of a Narcan reversal, first of all, you're going to call 911, or you're going to have someone else do it for you. You're going to make sure that you put on some rubber gloves and clear the immediate area of any glass or sharps that you may kneel on or that the person may roll onto. You're also going to clear their airway, just to make sure. Then you administer the Narcan, taking it out of its blister package, inserting it in the nostril, and depressing it. If you've ever used nasal spray during a cold, it's exactly the same process. Then you're going to put the subject in a recovery position, which is going to roll them onto their side, one leg over the other, one arm underneath, one arm laying forward. Do not move them if their neck or spine is injured, though. You're going to note the time of the first dose, and after that, you're going to administer secondary and third doses, if needed, every 2.5 to 3 minutes. You're going to want to manage the onlookers. There will be people who will want to be helpful, let them know that you have the situation under control and that 911 has been called. If possible, try to find out what they ingested. This is simply to render better care when EMTs arrive. So it's not uncommon for multiple doses to be administered during a reversal. This is especially true in cases of fentanyl overdose. 1 dose should be every 2 to 3 minutes, as mentioned before. While you cannot harm the subject with multiple doses of Narcan, administration of extra doses before the recommended window will not enable a faster reversal. It will only waste the dose. If a person is in a state of opioid overdose, they should start to show signs of successful reversal within 2 to 3 minutes of first dose. They may have body spasms, begin coughing, vomiting, or even convulsing. It is important to not try to touch them or restrain them during this time. When they regain consciousness, they may be disoriented or even possibly combative. When an opioid overdose is reversed, the subject will wake up in a state known as dope sick. This means that they will feel as if they have not received a dose of their preferred drug at all. If the person uses opioids as a form of pain management, that pain will also be present at highly aggravated levels. The typical duration of a Narcan reversal can be anywhere from 30 minutes to an hour. After this time frame, the person can slip back into an overdose if not treated by medical personnel. If the person remains on the scene, inform that they were administered naloxone and that help is on the way. Advise them that they are still at risk for relapse. They may be angry that you called 911 or use naloxone on them. De-escalation and trauma-informed care help greatly in these situations. Let them know that you're there to help and that you want them to live. Unfortunately, some people will attempt to leave the scene, sometimes in a hurry. Do not attempt to restrain them. Just note which direction they went in and let EMTs know when they arrive. Afterwards, be prepared to take some personal time to decompress and reflect on the experience. Consult mental health professionals if you determine it to be necessary. Your health and well-being are just as important to a successful Narcan reversal as any other component in the process. Thanks for watching. Have a good day.